Hello, I'm Dr. Aniketh Venkataram, Consultant Plastic and Aesthetic Surgeon at the Venkat Center for Aesthetic Health, Bangalore. Nowadays, liposuction has advanced a lot than what it used to be. Before, liposuction just meant putting a tube in and sucking out fat. But now there are so many technologies and it can be confusing for a patient. You have manual, you have powered, you have radio frequency, you have laser, you have ultrasound, what is good, what is bad. It can be very overwhelming for a patient to understand. So today let us break it down, let us understand what all these terminologies mean and what these various advances in liposuction actually mean. Now traditionally just basic simple liposuction means there is a metal tube connected to a suction cannula, and what this does is it gives suction and that tube sucks out the fat. So you make small holes in the body, you put this tube under the skin and this sucks out the fat. This is what is known as manual liposuction and it is the most simplest form of liposuction there is. The next advance came with something called powered liposuction. This is where the machine vibrates the liposuction cannula. So along with the physician moving the cannula to and fro, the cannula also vibrates. What this does is it breaks down the fat better and it sucks out the fat in a more even manner. So this is the basic difference between manual and powered liposuction. The next advance came in terms of using energy. Energy means anything that generates heat. This can be laser, it can be radio frequency, or it can be ultrasound. What is the point of this energy? So what this energy does is it breaks down the fat becomes more smooth and liquid so that it comes out in a more even manner. At the same time, this energy is applied to the undersurface of the skin and this stimulates collagen formation and skin tightening. So the advantage of using an energy based device is that along with removing fat more evenly, it helps to tighten the skin at the same time. Otherwise, if you're just removing fat without tightening the skin, you can be left over with some loose and baggy skin at the end of it. So which is the best over here? Well, there is no simple answer to this. What I will say is that having a powered device is better than just doing it manually. It helps you to do more things and you can remove fat in a more even manner. And this is in terms of removing the fat. And it's also good to have some energy device which helps to tighten the skin, because the powered liposuction isn't going to tighten the skin. Now, which energy device? Everything has its pros and cons. Someone with a laser machine will tell you laser is better. Someone with a radio frequency will tell you radio frequency is better. Ultimately, I can boil it down by saying it depends on the surgeon's competence, and having an energy device is better than not having an energy device at all. And at the Venkat Center, we do powered liposuction and we do skin tightening with a radio frequency. Now the next question, what is high definition liposuction? So high definition liposuction is again where along with simply removing fat, you're trying to create contours to give a 3D effect. Before you would just remove fat in a rough manner, while this would reduce the volume, you would be left with a very kind of flat appearance. So in high definition liposuction, you are creating the natural shadows and contours that the body has. So in the abdomen, you would look at creating a six-pack look. In the chest, you would look at enhancing the outline of the pectoralis muscle. In the arms, you would look at enhancing the outline of the deltoid muscle. So this is not some technology. It is basically how the surgeon is doing the liposuction to create these hills and valleys and these shadows. So the next question is, what about fat transfer? Well, this is the next advance, wherein after removing that fat, people thought, hey, why do we need to simply throw away this fat? Can't we use it? And that is where fat transfer came into being. And this fat transfer can be used to augment the breast. It can be used to improve areas of the face that are kind of sunken in as well. So this is typically done at the same time as the liposuction, and it's kind of a 2-in-1 benefit. The other advance in liposuction which we do at the Venkat Center is we do something called safe liposuction. SAFE stands for separation, aspiration, fat equalization. So here, along with removing the fat, at the end of the procedure, we use our microair device to break down the remaining fat so that what is left over is spread in an even manner. We don't want any grooves and irregularities to be left over after the procedure. Remember, the best surgery is one that no one is aware that you've had surgery at all. So how do we decide what technique is needed for which patient? Well, this comes to the surgeon's judgment. Some patients are good candidates for high definition liposuction, some patients aren't. Typically, creating a six-pack is good in someone who is already muscular. Remember, when you go to a gym, the six-pack is the last thing that you get after you develop your arms and pecs. So if someone does not have very good arms and pecs, but they're roaming around with a six-pack, that looks weird, it looks awkward, it does not look natural. So this is where we advise the patient. We get a lot of patients who are unfit who come and saying we want a six-pack, and it is our job to tell them that no, this is not going to look good on you, it's not going to look natural on you. We're going to do a simple liposuction, help you reduce your volume, and then you can work out on top of it, and that way you'll be able to get a six-pack. So what is the recovery time after these liposuction methods? Well, the field of liposuction has progressed so much that now recovery is very quick. And at the Venkat Center, we perform these procedures under local anesthesia. which means we only give anesthesia to that area that we are operating on. We don't make you unconscious. We do it this way because it makes the surgery very, very safe. You're avoiding all the risks of general anesthesia. You're also avoiding the really bad complications of liposuction, such as causing any deep perforation. The only downside to local anesthesia is that there's a limit to how much we can do in one day. We can't do arms, abdomens, thighs, everything together. We would have to break this up into various sessions. But the good side is that your recovery is very, very quick. You walk into the operating room, you walk out of the operating room. There'll be dressings for a couple of days, and 3 days after the procedure, you can go back to work. You can start brisk walking immediately. You can start cardio after 2 weeks. You can start weightlifting after 3 weeks. By around a month and a half, you're almost completely normal. So I hope these answered some of your questions regarding advanced liposuction.